Welcome to the Postgraduate Certificate in Advanced Ageing and Frailty Studies, here in the discipline of Medical Gerontology in Trinity College, Dublin. Today you'll hear from myself, Dr. Nullig Burke, the course director, and also from Professor Romero-Ortuno, the course coordinator. In this presentation, we would like to cover what the discipline of Medical Gerontology is. We would also like to give you an overview of frailty and what we intend to offer as part of our postgraduate certificate in advanced ageing and frailty studies. And finally, we would like to present to you why you should study at Trinity College, Dublin. So firstly, we'd like to introduce you to ourselves and the discipline of Medical Gerontology, which is within the School of Medicine here. So who are we? Well, I'm Dr. Nullig Burke. I'm an Usher Assistant Professor in Inflammaging within the discipline. And I'm also the course director of this postgraduate cert. My research focuses on the ageing process within the body and how that leads to dysregulation of the immune system and what that means for frailty.
My name is Romero-Ortuno, and I am an Associate Professor in Medical Gerontology in the School of Medicine in Trinity College, Dublin, and a Consultant Physician and Geriatrician in St. James's Hospital, Dublin. I am very pleased to be the course coordinator for this postgraduate certificate. I bring leading research into dynamic modelling of frailty and frailty assessment tools. I have clinical and academic expertise in frailty, dementia, delirium, and comprehensive geriatric assessment. The discipline of medical gerontology has the mission to support the education and training of an adequate number of skilled healthcare professionals who will be equipped to tackle the aging challenges of the future. We strive to enhance the health and care of the older person in all care settings, as well as promote research to determine innovative responses to the aging process. We would like to maximize and promote healthy aging by developing and maintaining the functional abilities that enable well-being in older age, adding life to years and not simply years to life. The discipline of medical gerontology is internationally recognized as a global leader in aging and frailty research. The discipline hosts the Irish Longitudinal Study on Aging, TILDA, in which over 8,000 adults over 50 years of age have been participating for now 10 years. This is one of the very few studies of such scale internationally. We are embedded within the clinical setting of the Mercer's Institute for Successful Aging in St. James's Hospital, where we engage with clinical partners in researching cutting-edge diagnostic and treatment strategies for age-related disorders in a state-of-the-art, world-class setting. Frailty is a clinical recognizable state of increased vulnerability resulting from decline in reserve and function across multiple physiological systems. While the prevalence of frailty increases with age, some chronologically younger patient cohorts are also significantly affected by frailty. This is because frailty is more closely related to biological than chronological age. Importantly, frailty is a dynamic concept, and research is now showing that frailty can be delayed and even reversed, both in populations and individuals. Frailty is important because it's highly prevalent, especially in older adults and in people living with chronic disease. Frailty is associated with an increased incidence of geriatric syndromes such as poor mobility, falls, and cognitive impairment. And most importantly, the presence and severity of frailty strongly predicts healthcare service utilization, meaning that frail service users are greatly in need of highly trained and specialized healthcare professionals in all settings, with a deep and appreciative knowledge of frailty and its management. The early detection of frailty can lead to better outcomes, and a person-centered approach will be facilitating so.
We would now like to give an overview of our postgraduate certificate in Advanced Ageing and Frailty Studies. This certificate is directed towards a wide range of healthcare professionals, including medicine, nursing and allied health disciplines. The aim of this certificate is to improve knowledge and inform clinical practice in the area of ageing and frailty. This cert will utilise both theoretical and practical methods of teaching and learning. To facilitate healthcare professionals working clinically, this certificate will be delivered over the course of 1 year and part-time. It will use a blended method of delivery, which means that some of the teaching will be delivered in person and some of it will be delivered online. 30 credits will be covered over 4 core modules. In-person teaching will be conducted either in the Trinity College Dublin main campus or within St James's Hospital campus in Dublin 8. Students will also attend clinical areas within St James's Hospital for demonstrations and practical tutorials. At the end of this certificate, you will be awarded a 30 credit NCQ Level 9 certificate. The term schedule will be over the Michaelmas and Hilary terms, which covers the months of September to May. So what are the entry requirements for this certificate? We require the student to hold a primary honours degree in health sciences at 2-1 or above. However, we will consider some exceptional circumstances. You should be a healthcare professional with an active professional membership, or you should be working in a management policy advisory role in an organisation or healthcare setting. As much of the course will be delivered online, students will be required to own a suitable desktop laptop computer with associated camera sound system and good quality broadband connection to allow for full participation in the course. There are 4 core learning outcomes that the student is expected to know by the end of the certificate. These will be: you should be able to explain how physiological changes during the ageing process leave the body more susceptible to developing ageing-associated conditions, with a focus on frailty. You should be able to list and explain methods of common geriatric assessment tools and their practical integration through the comprehensive geriatric assessment method. You should be able to demonstrate the clinical skills necessary to perform the comprehensive geriatric assessment. And finally, you should be able to demonstrate an ability to apply theoretical and clinical knowledge in a research setting. This content will be delivered over 4 core modules. The first module will be a 10 credit module on the biology of the ageing process. The next 2 modules will focus on frailty in ageing adults. Both of these will be 5 credits each. One will be more focused on the theoretical and the other will be focused more on the clinical practice. And finally, there will be a 10 credit module in quantitative analytical tools for ageing and frailty studies. So module 1, the biology of the ageing process. This module is coordinated by myself, Dr. Nollaig Burke, and is worth 10 credits. This module aims to provide theoretical underpinnings of what happens to the body during the ageing process. There will be a focus on how age-associated physiological changes can leave us more susceptible to developing age-related diseases. It will consist of lectures and demonstrations along with some pre-recorded materials from our sister MOOC module. And at the end of this module, the assessments will be a combination of examinations, written assignments and completion of pre-assigned tasks.
Module 2, Frailty in Aging Adults, is coordinated by myself and it's worth 5 ECTS credits. This module has already been running as a standalone module since 2019-2020. The module aims to provide a clinically focused overview on frailty, its operationalizations, and how to apply them in clinical settings. The module is closely linked to the practical content in Module 3 and consists of lectures, which can be in person or online, and will be assessed by an end of semester written assignment and completion of pre-assigned tasks. Module 3, Frailty in Aging Adults Clinical Practice, is also worth 5 ECTS credits and aims to provide an overview of the clinical assessment of key geriatric and frailty syndromes with an emphasis on the practical use of common geriatric assessment tools in the real clinical practice setting. Students will attend St. James's Hospital Mercer's Institute for Successful Aging and will interact with an array of clinicians in simulated or even real patient care settings for practical sessions. Practical sessions will culminate in a session where the student will complete a simulated comprehensive geriatric assessment. The module will be assessed via practical skills-based assessment and peer workshop participation. St. James's Hospital will host the clinical practice module and is a state-of-the-art facility for aging and research, and it has 4 pillars: education and development, clinical practice, research and development, and creative life. Students will be exposed to facilities such as the Robert Main Day Hospital, the Pulse and Syncope Unit, and others. Module 4 will cover the quantitative analytical tools for aging and frailty. This module is worth 10 ECTS credits and aims to provide a fundamental basis for statistical analysis and quantitative skills in aging and frailty. Students will attend computer laboratory spaces in Trinity for seminars, along with online peer workshops. Students will be familiarized with statistical concepts, statistical software packages, and how to run common analyses using real data provided by our Tilda partners and others. The module will be assessed via software-based assessments and workshop participation.
Finally, we would like to briefly tell you about why you should study at Trinity College Dublin. Trinity College Dublin, or the University of Dublin, was founded in 1592, which makes it the oldest university within Ireland. Trinity has 3 main faculties: the faculties of Arts, Humanities and Social Sciences, the Faculty of Engineering, Maths and Science, and also the Faculty of Health Sciences, which is where the School of Medicine sits. The Faculty of Health Sciences at Trinity has a very close partnership with St. James's Hospital Dublin. And Trinity research and teaching facilities are embedded within the St. James's Hospital campus and are closely aligned with clinical needs. So why study at Trinity? Well, Trinity is Ireland's leading university. It's ranked number 1 in Ireland and 101st in the world. Within Europe, Trinity is ranked 37th and first within Ireland for teaching and learning. And finally, in terms of research, Trinity is ranked 14th in the world for research impact in recent rankings. If you would like to know more about this course or require any further information, please contact our course administrator, Ms. Siobhan Hedigan. We will be happy to take any questions. Thank you.